deficiencies. D3 is said to be about 3 times as efficient as vitamin D2 by some people. D3 comes from an animal. D2 comes from mushrooms or yeast or sometimes soy. And in order to get the vitamin D to be effective as a supplement, you have to irradiate it. And after it's irradiated, it is refined to the point where it's actually a pure vitamin with no traces of anything else but that vitamin. Then it gets put into foods as fortification, or it might get changed into a food substance in certain circumstances, which I will get into in a few minutes. So, sunshine. A person can get significant amounts of vitamin D from being in the sun in relatively short periods of time. That means about 15 to 30 minutes, that you can absorb up to about 20,000 IU of vitamin D, which is far above the amount that you need. So if you were out in the sun every single day and you were not putting on sunscreen, you would easily get enough sun if you live in the right place. And that means in the winter it is more difficult depending on where you live. If you live too far north, you may not get any at all. If you're above 42 degrees north latitude, which is approximately at the border of Northern California and Boston from November to February, you wouldn't be getting any vitamin D that would be significant enough to do anything. So you also can't get UVB rays through your windows. So that's another thing to keep in mind if you're not going outside. The good thing is if you are getting a lot of vitamin D in the summertime, your body stores the extra vitamin D from the sun exposure in your body fat. So you can be using that in times when there's not a lot of sun available. So that being said, we can move on to why we would want to add the supplement into our life, and there is good reason for that. One is that even if you get a lot of vitamin D from the sun, if you wash your skin every day with soap, then you actually won't be getting any of that vitamin D, or not significant amounts, because of the fact that it takes about 48 hours for your body to absorb it from your skin after your skin has been absorbed. So it's just a good thing to keep in mind that you should probably not wash your skin every day. And if you know you've been out in the sun and you're specifically trying to get your vitamin D that way, then you shouldn't wash your skin for a couple of days with soap after you are exposed. And moving on from there, the sun is actually a really good thing. I've read a lot about it, and some people would argue that you shouldn't be in the sun at all without sunscreen, but there's a lot of people who get different types of cancers who use sunscreen, and at low exposure rates, and especially if you have high levels of antioxidants in your body, you don't burn as easy. And if you don't, when you're not burning, your body is using that sunlight for a good purpose. So those are some things to keep in mind, and you can read and check out the evidence for that more too. There's a lot of support to just know that the sun is actually a really good thing for you. So signs of deficiency or risks of deficiency: autoimmune diseases, fibromyalgia, early macular degeneration, rheumatoid arthritis, multiple sclerosis, diabetes, high blood pressure, prostate, breast, ovarian, and colon cancers, some forms of low back pain, mainly in women, osteoporosis, and rickets in children, to name a few. And some of the benefits of taking vitamin D would be increased immunity, preventing lung infection, killing viruses and bacteria and cancer cells, strengthening teeth, improving cognition or your memory and concentration, for healthy bone and musculoskeletal systems. It controls bone metabolism, and it increases calcium absorption. According to some experts, it helps to get calcium out of places they shouldn't be, like as plaque in arteries and into bone. It also has been useful at relief of depression in some people, and at healthy breast and prostate tissue, or for healthy breast and prostate tissue, and proper cell replication. Your cells will reproduce, but they might not reproduce properly if you don't have enough vitamin D. You absolutely have to have vitamin D for certain types of DNA replications. So there are the food sources for vitamin D, vegetable and animal sources are mushrooms, and more vitamin D is created in mushrooms when they are exposed to ultraviolet light. So if you sun dry certain mushrooms, they can become relatively high in vitamin D2. And fish flesh, fish liver oils, beef liver, egg yolks, and cheese. I do want to caution you about different liver examples. For example, like beef liver, you can kill yourself by eating too much beef liver in one sitting. For example, by getting too much of certain vitamins like vitamin A palmate. Just a good thing to be aware of. Now, the old school says that you should probably have about 400 to 600 IU for adults, and according to new research, it shows that you actually probably need a lot more than that in order to really be healthy. And the upper safe limit used to be 2,000 IU per day. The new school says that the safe upper limit is about 10,000 IU per day, although I wouldn't recommend that you take that much unless you really know that you're deficient. And during the times of the year when we don't get much sun exposure, 2 to 4,000 IU of vitamin D supplementation is good for your overall health. So if you stick between 2 and 4,000 IU, you are well within the safe range for adults of taking vitamin D. And in that case, for almost all of the population, you would only receive benefits from taking it. And once you have sufficient levels in the body, then you can use about 1,000 IU to maintain those levels. And it's probably good to get a blood test to make sure that you know what your levels are. And you're looking for something that is at least 32 as a number for serum levels of hydroxy vitamin D. It's 125 hydroxy vitamin D. That's what they'll test for. And if you have up to 500 number, then you have way too much vitamin D. And most people wouldn't be in that situation, but it's something that would be worthy to check out. And if you're going to take vitamin D, just stick with the recommended dosage on the bottle or whatever kind of packaging that the supplement comes in, and then you should be in a good range just for